Hey everybody, how's it going? So I wanted to make one final video pertaining to the aortic valve surgery I had. It was 4 weeks ago today that I had the surgery. So 4 weeks on here, I've healed a lot from it. I'm back at work. My exercise routine is solid, and I've been able to just improve pretty consistently here. So I'm very happy with it overall. A couple of specific changes to let everybody know. So when I came out of the surgery, I was on 3 different medications. I was on a small dose of aspirin to try to minimize any clotting around the incision that I had. I was on a dose of a blood thinner called Eliquis. I was on Eliquis before the surgery too. But I've been on, a slightly smaller dose of that over the last month. And then I've also been on a beta blocker called metoprolol, which is basically a drug that regulates the rate of my heartbeat. So I was showing some signs of atrial fibrillation coming out of the surgery, so they put me on the beta blocker in order to try to minimize that while the heart was going through its healing process. So I had an appointment with my cardiologist here yesterday, and I'm off the aspirin and I'm off of the beta blocker. So the response to the beta blocker has been interesting. So, that was a drug that was regulating my heart rate. So coming off of that drug yesterday, we had started doing it progressively in advance of yesterday, but coming off of it yesterday completely, I did wake up last night with an elevated heart rate a couple of times. And this morning, it was a little bit elevated. It's starting to settle back down now. It's been settling through the course of the day. And I'm happy to see that. So I anticipate within the next few days it should be back down to where it was. So the only medication I'm currently on is the blood thinner Eliquis, and I'm going to be on that until for a few more months. We're going to do a CT scan of my heart in late May, early June, sometime in that range. And we're going to just make sure that the structural changes that happened within the heart itself are holding. The main one that we're concerned about there, obviously the aortic valve, we want to make sure that that's holding. That seems to be, very confident in that particular work. The one additional thing we're going to double check is whether or not the closure of my left atrial appendage is still stable. If it is, then at that time I'll be able to come off of the blood thinner. The reason for that is because the left atrial appendage is just basically a little, it's not a separate chamber in the heart, but it's just a kind of like a little pouch in the left atrium, which is one of the smaller heart chambers. And frequently, if you have a higher heart rate or atrial fibrillation, blood clots can form because of turbulent blood flow in that little chamber, and those can cause stroke. So because there's a history of stroke in the family, and also because I had a transient ischemic attack back in April, which is basically a mini stroke, we're going to stay on the Eliquis just for a few more months until we confirm that the left atrial appendage is appropriately closed. So, and then I'll come off of it at that time. So anyway, 4 weeks in, there is still some healing to be done. My legs are feeling a lot better than they were. There's still a little bit of pain in my right leg, caused by the incisions that we did in the femoral arteries to be able to put the catheters in to be able to redirect the blood flow to the heart so that the aortic valve could be changed. So, but that is healing. That's actually improved significantly over the last couple of days. Still there, still some stuff to go, but it's improving. The muscles, the incision is right here. near my, just in front of my underarm on the right side. That incision is healed up pretty well. It feels like most of the stitching is dissolved, and now it's just a matter of rebuilding and strengthening the muscles that were cut. And I'm well on the way to that right now. I've been doing some resistance training on that to rebuild those muscles, and it's responding well. And I've been able to work now in the chiropractic office without any restrictions. I'm able to adjust just about any situation now. So that's good. So some healing still to be done, but I'm well on the way. So three things I just want to share to anyone who might be have one of these procedures in their future. One of them is do your best to make sure that you've researched your options. By options, I mean what procedures can be done. You may get 2 or 3 different opinions from 2 or 3 different surgeons. It's valuable to do that, but do your own research so that you can see what procedures are out there, and then you can check in with the surgeons to see if you're a candidate for those. The option that was initially presented to me was a full sternotomy, which basically means that's the old school procedure where they divide your sternum and open it up and then operate on your heart completely open. So I really didn't want to have that, and I found this alternative option, which has worked really, really well. So do your research. That would be the first thing. The second thing would be don't be afraid to ask lots of questions to your team of doctors. It's always better to have a question answered, even if you think it might not be the best question in the world or the most informed question in the world. These folks are there to be able to arm you with the information you need to be able to make good decisions. So make sure you get your questions answered when you do interact with your physicians. And then the third thing that I would say would be do your best, if you do have a procedure like this in your procedure, to physically prepare yourself for it. Do your best to go in as best a condition as you can so that you can enhance your body's ability to heal from the procedure afterwards. So I feel good about my healing process so far. So part of that is the skill of the surgeon that I worked with. Part of that is me going into the procedure with some good health disciplines that I've been able to maintain during the healing process here over the last month. So try to go in as best a shape as you can, and that way you'll come out stronger and as quickly as possible. So this is the last video I'm going to share about the aortic valve procedure that I had. So if anyone out there sees this video and has anything they want to ask about or talk about, I'm available for that. You can send me a message, and I'm happy to assist in whatever way I can so that there's more healthy hearts out there. So thanks so much for hanging out with me for the last few minutes, gang, and have a wonderful night. This is Angelo signing off, and I'll see you all on the bike trails and the hiking trails.